Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I've got a question from a mum with a young baby. She says, my baby's always snuffly. Has she got a cold? And what can I do about it?
This is a really common question. I'm being asked this all the time, particularly by first-time mothers, I would say. And the first thing to say is that new babies have tiny little nostrils. And so, and they have to breathe through their noses. They can't breathe, they don't work out how to breathe through the mouth for a long time. So very often a newborn baby, a perfectly normal newborn baby, will sound snuffly because a little bit of secretion in the nostril and they'll sound very snuffly. And what you need to watch is my baby, is the breathing pattern all right? In other words, are they breathing fine but just sounding noisy?
That's interesting.
Or are they struggling to breathe? Now, if your baby's struggling to breathe, they're really working at it, then you can go along to your chemist and try some saline nose drops, because a little bit of saline, which is just salt water, will help to clear out the secretions in the nose and will often help the baby to sneeze a little bit, clear out the nose, and then they'll breathe much more easily.
So it's a pattern you're listening for?
Yes, it's are they struggling? Are they really working at it? Can you see their chest going in and out and really making a lot of effort? Or are they actually just noisy breathers, but actually quite comfortable with it?
And then, of course, children do catch colds. Some babies seem to have a cold for a long time in their first year, and others don't. Is that something to really worry about?
Well, that's a very good question. If they've just got a little bit of a cold and they're a bit more snuffly than usual, they've got a little bit of a temperature, but they seem well, or a little bit of a cough, and they seem well in themselves, you can just use things like proprietary things you can buy in the chemist, ibuprofen or paracetamol.
All for children, of course.
All for children, children's preparations, and make sure they settle down. If they've got a high temperature, you do need to go and see your doctor, particularly in the babies under 6 months old.
Yes, temperature's a big key, a warning sign,
isn't it? It's a warning sign. Or if they're just not feeding properly, if they're drowsy, if they're just not right, they just don't seem alert, then you need to go and see your doctor.
Good advice, Sue. Thank you very much for that. If you have a similar problem, we hope we might have given you some help, but remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.